All right, everyone, so this is endotracheal tube placement and endotracheal tube suctioning. What we're going to do is basically just start with a patient that is apneic but has a pulse. So, sir, can you hear me? Check for a pulse, no sounds of breathing. Just like the previous skill, we're going to do a head tilt chin lift and start bagging the patient, making sure the airway is patent. Lifting the jaw into the mask, give them a breath. Go ahead and hook this up to oxygen at 15 liters. Measure and place your OPA. And from the start of the skill or in between bag valve mask ventilations, you don't want to go longer than 30 seconds before you maintain the oxygen saturation back up to 100% again. Okay, so we're going to bag at a rate of once every 6 seconds. At this point in time, we can go ahead and pass it over to a partner who's going to take over the bagging. Verbalize that you're going to have to do a two-handed mask seal if you do have a partner or a couple of aides. For this sake, we just have one partner, so we're going to have him do a two-handed mask or a one-handed mask seal. Assemble my equipment. Got my laryngoscope blade and handle. Light is white, tight, and bright. Got my 7.0 tube. I'm going to go ahead and lube it. Depending on the mannequin you use, you're going to have to use a silicone-based or an oil-based lubricant. They're both different depending on the mannequin. Got our syringe set at 10. Hook that up. Go ahead and slide our Thomas device underneath so it's ready to go. All right. At this point in time, we're going to go ahead and pre-oxygenate the patient. Making sure your O2 sats are above 100. And one thing that we forgot we got to put on there is the nasal cannula. So we want to get a second oxygen source and hook this up to 15 liters per minute. And we're going to apply this on here real quick. Okay, go ahead and start bagging again. Make sure you have your capnography in line whenever we start this, whenever we start bagging the patient. Okay, pre-oxygenate. And ready. Remove your OPA. Come in at the right. Find your vallecula. Open up. Place your tube. Inflate your bulb. Remove your stylet. Go ahead and ventilate. Again, capnography. Put our stethoscope in our ears. Listen. 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 No epigastric sounds. We do have sounds in both bilateral lungs. Mark your thing at the teeth. So we are at 20 at the teeth. And then we can go ahead and apply our Thomas device at this time. Okay. Make sure that you have your PEEP valve on. Anytime we intubate a patient, we need to have PEEP on the patient at all times. Set at 5 for now. All right, so at this point in time, once you have the patient intubated and you've verified you have good placement, we're going to simulate that we have exited in the tube, so a bunch of pus or fluid that's coming up out of the tube. We're going to go ahead and grab our appropriate sized French suction device, so our soft suction catheter. We're going to head and find our oxygen source or suction source and turn it on. Apply your suction catheter there, and then we're going to go ahead and pre-oxygenate the patient, and then remove the bag valve mask. Try to keep this as sterile as possible. We're going to apply this down, and we're going to go until we meet resistance, which is where we have the carina. Once you meet resistance, back it up just about a centimeter, and then start suctioning. Then we're going to rotate on the way out. Rotating, rotating, rotating. Make sure you don't flick your partner like that. Then go ahead and suction in some sterile water to clear this out. And then you can go back in a second time if you need to. But for that, that's all you need. Reassess your patient, listen to breath sounds, check your capnography, and make sure your tube is in the right place again.